Behind every single safe and effective medical procedure, every critical decision a nurse makes, there lies a deep, fundamental understanding of the human body's map. And that map is called anatomy. It's really the invisible foundation that all of modern nursing is built on.
Okay, so let's dive right into this. The best way to think about anatomy in nursing is to picture it as a bridge. Seriously, on one side, you've got all the textbook knowledge, the complex structures of the body. And on the other side, you have actual nursing practice, the hands-on stuff like giving a shot or checking a pulse. Anatomy is that essential bridge that connects the two. It makes sure every single action is precise, safe, and effective.
So in this explainer, we're basically going to walk across that bridge together. We'll start with why anatomy is the cornerstone of care. Then we'll look at how nurses map out the human body, see how they turn that knowledge into real-world action, and finally, how it all comes together to become the ultimate safety net for every single patient.
All right, so let's start with the absolute basics. Why is anatomy even considered the cornerstone of all medical knowledge? What makes it so important?
Well, at its core, the definition is pretty straightforward. Anatomy is the science of structure. It's like the detailed architectural blueprint of the human body, from the biggest organs all the way down to the tiniest cells. It's all about knowing what goes where and how everything is connected. And this is exactly why it's so critical. Without that internal map, a nurse is basically flying blind. Think about it. How can you correctly evaluate a patient's condition or perform even a simple procedure if you don't know what's underneath the skin? It's almost impossible. The stakes are just incredibly high. Which brings us to the map itself. And this isn't just one simple, flat map. Oh no. It's more like a multi-layered 3D atlas of the body, covering everything from huge organ systems down to the microscopic level. To really master this map, a nurse has to understand all these core concepts. It's not just knowing where the heart is. It's knowing its precise shape, its different layers, and how it connects and works with, say, the respiratory system. They're essentially building a complex, three-dimensional puzzle of the human body right inside their minds.
And they're looking at that puzzle from two key perspectives. First, there's gross anatomy. That's the big picture stuff. Muscles, bones, organs, everything you can see with the naked eye. But then there's histology, which is the microscopic view, zooming way in on individual cells and tissues. You absolutely need both. Why? Because you can't really understand a disease if you don't understand what's happening on a cellular level.
And this right here shows how it all comes together. These different views, gross, microscopic, clinical, they aren't separate subjects to memorize. They're all essential tools in a nurse's toolkit, and they all work together to build that complete picture that guides everything they do.
Okay, so now let's bridge that gap from the textbook to the bedside. This is where all that theoretical knowledge gets put into action, sometimes in life-saving ways.
I love this line because it's so true. What might look to us as patients like a quick, simple, routine task is actually an incredibly complex procedure, and it's guided by a deep, invisible well of anatomical knowledge.
Let's break down some of these common procedures. When a nurse starts an IV, for example, they aren't just looking for any old vein. They're using their mental map of the body to pick the perfect one, while at the same time actively avoiding nearby arteries and nerves. It's a calculated, incredibly precise action. And the difference between doing it with and without that knowledge, it's night and day. Without anatomy, the risks are severe. We're talking bleeding, infection, even permanent nerve damage. But with that knowledge, the procedure is safer, the patient's pain is minimized, and the quality of care just skyrockets. So how do they navigate so precisely? Well, they use landmarks. The human body has its own built-in GPS system. Bones like the sternum, the ribs, and different points on the shoulder, they all act as reliable reference points, guiding the nurse's hands to make sure they're in exactly the right spot every single time. Now, this deep knowledge does so much more than just help a nurse perform tasks correctly. It actually elevates their role from being just an observer to being an active protector of their patient. This quote just nails it. Anatomical knowledge is the baseline for what's normal. And if you don't have a crystal clear understanding of what's normal, it's impossible to recognize when something's going wrong. It's what turns a nurse into a kind of clinical detective. And here's a perfect example of that. On the left, we see healthy, normal air sacs in the lungs. On the right, we see inflamed ones from a condition like pneumonia. A nurse can only spot the problem on the right because they have a perfect mental image of what the healthy tissue on the left is supposed to look like. That is anatomy in action, protecting a patient by spotting trouble early.
So this knowledge becomes a shield for the patient in so many ways. It ensures medications are given safely, it prevents errors during procedures, it protects vital organs and nerves from being damaged, and it even guides those systematic head-to-toe assessments that can catch any potential issues.
And here, you can see it laid out so clearly. Every single one of these pillars of patient safety rests squarely on that foundation of anatomy. From critical thinking to infection control, all roads lead back to a deep understanding of the human body.
Okay, theory is one thing, but let's see how this all comes together in a high-stakes, real-world situation.
We're going to look at something that happens thousands of times a day in hospitals everywhere, giving an injection into a muscle. But specifically, we're going to look at how a nurse uses anatomy to avoid injuring the longest and widest nerve in the entire body, the sciatic nerve. Now look closely at this diagram. This is not guesswork. To give this injection safely, the nurse is using their knowledge of the skeleton that's hidden right under the skin. They physically feel for those bony landmarks, like the top of the hip bone and a part of the thigh bone, to create a safe little triangle. This guarantees the needle goes right into the muscle, far, far away from that critical sciatic nerve, preventing an injury that could cause lifelong pain.
And that really brings us to our powerful, undeniable conclusion. Anatomy is not just some prerequisite course you have to get through in school. It is a fundamental, non-negotiable pillar of patient safety that directly leads to better outcomes and much higher quality care.
So the next time you see a nurse at work, just remember what's really going on. Their most powerful tool isn't the syringe or the stethoscope they're holding. It's that incredibly detailed three-dimensional map of the human body that they hold in their mind. Which kind of leaves us with a final thought. How does knowing that change the way you view healthcare?